So you were talking about plant toxins and anti-nutrients in these plant foods. Which of the compounds that you can find in plants are usually the most problematic for humans?
And there are a lot of them. Remember, plants make about 1 million defense chemicals, and that most of them will kill you, right? Because there are about 400,000 known plants in the world, and most of those will kill you if you eat them, even a small amount. Like water hemlock, North American water hemlock will cause intractable seizures because they block the GABA receptors in the brain, and so your brain cannot settle down. It has massive seizures that you cannot stop, and you're dead within 1 or 2 minutes, right? So even half a leaf of North American water hemlock has been known to kill adults. And kids chewing on the stems or putting them in their mouth have actually caused serious harm and even death. So those ones would obviously be the worst, and so those would be considered the inedible plants. But really, what we're talking about is the edible plants. Okay, what about the things that we do eat? And there are some that we can eat safer than others. Some are able to be denatured, so different lectins. I'd say that quite often lectins cause a larger burden of harm than a lot of other things. Lectins are a defense chemical that is a protein with a carbohydrate substructure that basically can bind to all the different sort of surface markers on our cells, bind to them, stick to them, and damage them, and elicit immune responses that we call autoimmune diseases. And that's actually been argued since the early 90s. There's a paper by Dr. Fried, Freed, in 1991, who argued that you can't actually explain these so-called autoimmune diseases by the body attacking itself. And that's actually true. I agree with that. And but all of these problems can be can be satisfied by the known consequences of plant lectins in the body. And so the treatment for autoimmunity in the 1800s was just a meat and water diet. You remove all these plants and things like that. And Dr. J.H. Salisbury first figured that out. He did a 30-year research project in the optimal nutrition for human beings, and he wrote a book called The Relation of Alimentation and Disease. So the relationship between what we eat and the diseases we get. And he argued that eating different sorts of plants and different sorts of things would actually cause different issues, dysbiosis, and some sort of toxic buildup, and these were causing all of these diseases. You just eliminate them and take them away, and I totally agree with that. And so now we're still seeing that. We're seeing that he didn't know about lectins and all the different sorts of different defense chemicals and things like that. But we're sort of learning about them now. And while you can cook and denature a lot of these lectins, they don't all go away. Gluten is a lectin, wheat germ gluten, and that causes celiac disease, which is considered an autoimmune disease. But it's called a gluten mediated autoimmune disease because when the gluten, the lectin, goes in, it sort of tacks and sticks to your intestinal cells. They're called villi, and you have microvilli that come on there, and they stick to them and they clump them up together. So they're called the glutenins. All lectins are a glutenin. They call it agglutination, which means cells sticking and clumping together. So like hemagglutinin, wheat germ agglutinin, these sorts of things. So they cause cells to stick together and clump up. So you can't have these things out there just collecting nutrients. They're all stuck together. So it's going to reduce your nutrition and absorption. You're going to get malabsorption. So in some unlucky few, the immune system then attacks that and damages those villi and microvilli because they're going after the lectins, but it damages your body in the crossfire because these things are stuck to your body, and so your cells are getting hit in the crossfire like casualties of war, civilian casualties. And the thing is, when you stop eating gluten, those problems go away. The damage stops, and the gut completely heals within 4 to 6 weeks, even though the antibodies for celiac stay elevated for 3 years after your last exposure to gluten. But they're slowly coming down, slowly coming down, slowly coming down. But if you have gluten again, they'll spike up again. And then they'll slowly come down and slowly come down. And then they'll spike up again if you have gluten. So that's obviously reacting to the gluten. It's not responding to your body because your body's still there. Those are obviously not autoimmune antibodies. Those are not antibodies that are attacking yourself. Your body actually can't attack itself. And I have a whole video on this called Rethinking Autoimmune Disease on YouTube that I gave at a medical conference, lecture I gave at a medical conference. And so lectins cause a huge burden of disease. And these can get in our system. They can cause leaky gut. They can allow these lectins into the rest of our body. And then those lectins can bind to all sorts of different tissue in the body. And sometimes it will have this immune response, and we call that autoimmunity. When you remove the lectins and you remove plants in general, potentially removing that glyphosate, which is a strong correlation with autoimmune disease as well. But we had autoimmune disease for centuries before glyphosate existed. So that's not the only cause. People blame seed oils, and seed oils are bad, but we had all these diseases for centuries and millennia before seed oils came in, and we used ketogenic diets 150 years before seed oils existed to cure diabetes. So people say, no, diabetes is only caused by seed oils. No, that's not true. We were treating diabetes since ancient Egypt. We were named it diabetes in 200 BC, and we were curing it with ketogenic diets, just removing carbohydrates since the late 1700s, eating mostly meat. And then Salisbury was curing people with autoimmunity and all these other sorts of things in the late 1800s before seed oils came on the market by putting people on a beef and water diet. So a lot of these things have to do with yes, carbohydrates, deranging our metabolism, but that's a major driver of disease as well. But I think as far as plant toxins are concerned, lectins are a big problem. They can cause malnutrition. They can cause malabsorption. They can damage and bind to the gut to globally reduce your absorption of any nutrients. And then they get into your body and they attack and damage your body. And this can elicit autoimmune issues. And so that causes a huge burden of disease. And when you eliminate these lectins and plant toxins, autoimmunity basically goes away. And for most people, I've seen dramatic results with autoimmunity. It's pretty remarkable. And so, but there's a lot of other things, and the lectins come with other things as well. So you're not going to just get one. And even the lectins, a lot of these things are found in beans and seeds, legumes, nuts, because the seeds are a plant's baby, and that everything protects its baby more than anything. So this is where you typically find the highest concentration of toxins, and you'll find a high concentration of lectins. And this is why most beans are actually inedible. We've just made them edible through technology. So red kidney beans, you have to soak them and boil the hell out of them. And without that, they can be very toxic. And the WHO, on that website I mentioned, they even say in the lectins section that as little as 5 red kidney beans, uncooked or undercooked, have actually put people in the hospital, right? So that's very toxic, right? And we eat these things, right? But if you don't cook them properly, you can get very sick. In Japan, there was a cooking show, and they said, oh, we're going to cook these beans in this way. And I don't know if they described it poorly or what they did, but I think something like thousands of people got sick and hundreds of people had to go to the hospital because they didn't prepare these beans properly. And they just sell this at the store, right? So those can be very toxic. So the lectins can be very, very toxic. They can kill you. Actually, the most toxic substance that exists on Earth that we know of is a lectin. It's called RICIN. And it's used in assassinations and things like that. It comes from a castor bean, and the sort of the shell underneath the shell is sort of a skin around the bean, and that's very toxic. You have to take that skin off, and that has ricin in it. And so that ricin, when purified and things like that, is one of the most deadly chemicals in that we know of. And I think it's as little as 1 microgram per kilogram is enough to kill basically any animal. So, and that's a lectin. Right, so the lectins can be very, very, very toxic, but they also come with other things as well. So they can cause malabsorption as well. But then you have phytates, which bind to different minerals and cause malnutrition from that. You have oxalates, which will bind to minerals, but also cause damage and buildup in your tissues and can cause disease. Actor Liam Hemsworth actually put himself in the hospital with acute oxalate poisoning a few years ago from drinking spinach smoothies every morning for 3 weeks. And spinach has a lot of oxalates in the form of oxalic acid, which is really nasty, caustic stuff. And we're eating this stuff, right? And then you have saponins or protease inhibitors and tannins, which bind to proteins and denature them, prevent you from absorbing them. So they cause malabsorption, malnutrition. And I've seen this in patients where most people are very deficient in these nutrients, and maybe they're not eating enough of these nutrients, but they're also eating it with anti-nutrients. That's another way that plants defend themselves. And I think that's a major way that plants defend themselves is the anti-nutrient effect, because if you can't get enough nutrients from your food, you will not thrive. You will not be healthy. You will not do well. And so that's what they're trying to do. They're trying to screw you up that way. They have hormonal disruptors as well. But The anti-nutrient effect, I think, is large, and coffee is huge on this. Coffee is a bean. A bean is a seed. The seed is a plant's baby. So I have tons of these lectins in there. We roast and then boil the hell out of these beans. And if you were to eat a raw coffee bean, you can get very, very sick because you at least you have to denature some of these lectins and toxins. Roasted and boiled and things like that reduces that lectin, but it doesn't get rid of them, and it still has a huge anti-nutrient effect as well. So it can trigger autoimmunity from the lectin standpoint, but it also has huge anti-nutrient profile. And so when I see people on a carnivore diet, their vitamins and minerals just improve dramatically on blood tests, and so we're looking at objective standards, and they're improving. Their health is improving. When they're drinking coffee, it's actually hard to get things like zinc and magnesium up because that will block out up to 100% of zinc and magnesium absorption and will actually strip out magnesium from the bloodstream. Caffeine generally will do that. And so if you're going to have coffee, definitely don't have it around mealtime. Wait at least 2 hours, let your body digest and absorb some of this stuff before you drink coffee. And also, you can't take pills with it because I have patients on medication who, if they have coffee within 2 hours of having those medications, you look up on their blood test, they will not show up. So people with thyroid dysfunction on thyroid medication, they actually, if they drink coffee within 2 hours, and I've tested this, we've found this out through trial and error, that if they have coffee within 2 hours, we test their blood levels. It's like they're not taking it at all. And then they just delay it by 2 hours or 3 hours or just stop drinking at all. It can double or even triple. And they're on medication. So this is blocking out the absorption of those medications. And so that anti-nutrient effect, I think, is a really, really big one. But if I had to pick one, I'd say lectins.
Right. Well, that about coffee, it's insane, and I think everybody should know about all of these toxins and anti-nutrients in plants, and then choose if they want to actually eat an almost herbivorous diet or to change to a carnivore diet, which is optimal for human health. So, when you propose to people a plant-free diet, they usually are very concerned about fibers and gut health. So, are fibers actually essential for having a healthy microbiome or even for bowel movements?
Yeah, no, not at all. And the thing is that we haven't traditionally eaten a whole bunch of fiber. We've been told that fiber is really good for us, and that came from the work of Dr. Burkitt, who came up with Burkitt's lymphoma. And he wrote a book in 1979, I think, called "Don't Forget About Fiber." And he worked in Africa, and he saw that these people had low rates of colon cancer, and he said, "Oh, they eat more fiber, and they have less colon cancer. Must be the fiber." I mean, it was based on zero actual scientific inquiry. It was just a blind guess based on his own opinions of things. And that actually hasn't been borne out by the evidence. Increased fiber doesn't actually lower your risk of colon cancer. It can actually cause inflammatory issues. It can cause microabrasions in your gut lining and can cause increased inflammatory reaction, increased mucus secretion, things like that. It can actually it's actually an anti-nutrient. Fiber itself is an anti-nutrient. It will form a physical lattice and block out the digestion and breakdown of food that you're eating and block out and stick to the walls of your gut, and so food can't actually get in and get absorbed even after it is digested, if it is digested. So studies have shown that it can reduce absorption by up to 30%, and it also binds to bile, which we have to break down and emulsify fat and absorb the fat. You can't really absorb fat without bile. For most fats, about less than 10% you can absorb without bile. So if you're eating fiber, it binds to the bile, and now you can't absorb as much fat. And your body's working really hard to absorb fat. You have 5 organs working in concert to absorb fat. Stomach starts breaking down the food. Your liver makes bile. Your gallbladder stores and concentrates bile. So if you don't eat fat every day, you can still get the same amount of fat absorption even after several days. Your pancreas makes lipase and other enzymes that break down that fat and releases it. And then your small intestine absorbs the fat and bile complex. And so if your body didn't want fat, if fat was so horrible for you and was going to kill you, why do we have 5 organs working together to absorb fat? That doesn't make sense. It wouldn't nature wouldn't work that hard to get fat, to absorb fat, if fat weren't good for us. And you have a limited capacity. You have a limited ability to absorb fat based on that bile. You run out of bile, you can't absorb fat. So if you're eating a lot of fiber, Now you can't absorb as much fat. You will run out of that bile more and you'll eliminate it out. Additionally, we make taurine in our liver that's considered a non-essential amino acid, but it's very important. It just means we don't need to get it from our diet. Well, some people do. Some people have a higher demand, and studies have shown that higher taurine intake dietarily actually improves health. Taurine only comes from meat, and uncooked meat or less cooked meat is preferable. But we make it in our liver that gets expressed in our bile, and we absorb that when we eat fat. So if we're eating more fiber, then that's actually going to bind to the bile and strip it out, and you're going to lose the taurine at the same time. So even just eating fiber, you can actually become taurine deficient. Even before we talk about the 30% reduction in absorption otherwise. I mean, this is some of the benefits they say that fiber has, because it says, well, diabetics, when they're eating more fiber for the same carbohydrate and other things, just adding in fiber, that actually reduces their blood sugar. How does it do that? Well, it blocks 30% of the absorption of carbohydrates. So, fun fact, you can just reduce your carbohydrate consumption by 30% and get the exact same result, or just eliminate carbohydrates completely and just not have diabetes at all. But that's how that works. And if you're not eating things that are harmful, like sugar and carbs and plant toxins and things like that, then you don't actually want to block out the absorption of the food that you're eating. You want to absorb all of it. And so that's going to be detrimental. Now, no one ever proved that we needed fiber. There are many tribes and peoples since time immemorial that have never eaten fiber. The Inuit, for example, they live in the Arctic Circle. There's no fiber. They're living on ice floes and things like that. They're just eating meat. And so, while they were eating the stomachs, that's just you saying that. That's not actually what they did. And a lot of times they ate seals and whales and fish, which are carnivores. And so if you're eating their stomach contents, you're eating other fish and seals and things like that. Polar bears, they'd eat those too. So they're not getting fiber, they're not having problems. And you look at the gut microbiome of the Inuit when they're eating their traditional diet. And there's a lot of things that influence the microbiome. But when they're eating their traditional diet, they actually found they have very diverse and healthy microbiomes, right? So we don't know enough about the microbiome to really make definitive statements. And we certainly don't know enough about how to manipulate the microbiome to make definitive statements. In fact, a lot of these companies say, okay, well, here's your microbiome. Yeah, it's okay. It's not great. But what you need to do is you need to eat more fiber and eat less red meat. And what people are doing is they're doing the exact opposite. They're cutting out all fiber in all plants and only eating red meat. And then 3 months later, their microbiome actually improves. And say, oh, great. Good job. You listened to us. No, we didn't. We actually did the exact opposite and actually improved our microbiome. Now, there are reasons for that. If this is our evolved, biologically appropriate diet, that diet should support our optimal microbiome, right? Because the microbiomes in all animals are supported by the food that they're eating. So they eat their optimal food that supports their optimal microbiome. The same goes for us. It also supports our optimal oral biome, which is part of your whole biome system. And so when you change what you're eating, especially when you get rid of carbohydrates, that massively changes the bacteria in your mouth to a much healthier form of bacteria. So very quick, simple proof on how humans are not designed to eat carbohydrates is that it changes our oral biome to breed for bacteria that rot our teeth, that cause cavities. It's the carb-eating bacteria that cause cavities. No animal on earth eats a natural diet in the wild that rots their teeth. Because if you rot your teeth and you lose your teeth, you lose the ability to eat and you die. And so no animal will have an evolved natural diet that makes them rot out their teeth and die. And so if we're eating, or any animal is eating, a diet that rots their teeth, and it goes for your pets too, that if they're eating something that's rotting their teeth, that by definition is not their optimal diet and is causing harm. Oral health is a window into overall health and especially cardiovascular health. And we get some of these oral biomes that are perpetuated by carbohydrates and sugar that actually show up in arterial plaques, that show up in glioblastoma brain tumors, that show up in Alzheimer's and Parkinson's and things like that in biopsies of the brain. So these could be actually causing direct harm to the body. Eating carbohydrates, eating fibers precipitates and breeds for those sorts of things. So no animal on this earth will eat something that rots their teeth naturally. So that's proof that that's not our natural diet, and that changes our oral biome. So when we go back to just eating meat, that goes back, and now we have a healthier oral biome. We don't get cavities. Everything you eat, you're chewing up in your mouth, and that bacteria is getting into the food, and you swallow that. And that food bolus can act like a Trojan horse, and some of those bacteria stuffed in the inside. Some of those will get through, some of them won't. If you just eat yogurt or probiotics, studies have shown they actually just die in your stomach acid. But eating it in a bolus of food, I mean, unless you're disinfecting your mouth with Listerine and things like that, which isn't a great idea, I don't think, because you actually want those. You want the healthy bacteria. It's just all these people. There's dentists now painting kids' teeth with iodine, like disinfecting it, like they're going into surgery or something like that. Do whales do that? Do koalas do that? Do lions have to do that? No animal has to do that. So if we're doing that, we're doing something wrong. And so those bacteria from your mouth are actually getting through down to your microbiome. And so I think that's where those bacteria are coming from. So you have a mouthful of probiotics all the time. You don't need to buy them. You don't need to waste your money on those sorts of things. As long as you're eating the right thing, you'll have the right oral biome, and that will seed your microbiome. And so you don't need fiber for that. You definitely don't need fiber for that. And in fact, in a lot of cases, you don't want fiber because it causes all those other problems as well. It also causes methane buildup because the bacteria start working on the fiber and secrete methane, which causes bloating and gas and discomfort. It also slows down the peristalsis. So it actually slows down your gut motility. And studies have actually shown, randomized controlled trials have actually shown that more fiber equals slower transit period. So it actually slows down, causes constipation, and causes increased symptoms with constipation and symptomatic, bloating, fissures, all these other sorts of things. And that reducing fiber improves these things, and eliminating fiber actually eliminated all problems in that study for those people that did that. So fiber can actually be harmful. Another argument that people say is that, well, the fiber starts getting broken down into short chain fatty acids, not much, but a little bit, and that gets turned into butyrate, which is a ketone product, and that feeds your intestinal cells. But when you're in ketosis, the main ketone body that you make is beta hydroxybutyrate. So it's the same thing. Your cells use that, and that's true because the thing is your body actually prefers ketones. And when you have ketones available and glucose available, most of your body will only run on those ketones, right? It's only when you don't have enough ketones that you start filling the gap with glucose. And so your intestinal cells can still run on glucose, because people that don't eat fiber and aren't in ketosis, eating junk food, their gut cells aren't dying. They aren't having massive intestinal failures or anything like that without fiber. And but they do prefer those ketone bodies. If you're in ketosis, you're going to get more of those through your bloodstream. But if you're also eating protein, you still get those short chain fatty acids, because your microbiome is now geared up to eat proteins and things like that. And so various amino acids can actually be broken down into short chain fatty acids and turn into butyrate as well. So you don't need the fiber from that standpoint either.
Awesome. Well, that was a very comprehensive answer. And
Mhm.
I actually am a living proof of this because I suffered from extreme bloating. I'm talking every single day, 24/7. I looked pregnant, and I was eating a diet very, very high in fibers, like any type of raw vegetables, cooked vegetables, but also a lot of grains, like high fiber grains. And I was trying to solve this problem. I had bloating and I had constipation for almost 2 years. And so I was feeling terrible. I went to the doctor and they gave me all kinds of fiber supplements. You know, those fibers
Yeah.
that are soluble in water and then they become like a gelatin. That
Mhm.
those type of supplements made it worse, like 10 times worse. And the only way I solved this problem was when I transitioned to a plant-free diet. So I wasn't eating any more vegetables, fruit, and grains. And in a matter of 1 or 2 weeks, I was never bloated again and I solved my constipation problems.
Oh, very good. I'm glad to hear that.
So,
Yeah, that's
yeah,
amazing.
so that was insane.
Yeah, you see a lot of people doing that too, and especially gut issues. I mean, because everything you eat goes through your gut, and so of course, what you eat is going to impact your gut health. And so, just making those very simple changes and then seeing those big results. I mean, that should tell you a lot about what we're eating. And if you're eating something that's causing those gut issues, causing teeth issues, you should really think long and hard about what you're eating, because that does not happen to other animals eating their natural diet. So that should tell you a lot, actually.
Yeah, but then, you go to your general practitioner
Yeah.
and he tells you, yeah, you need to eat more fibers, and you trust this
Hmm.
person. And so you end up having
Yeah.
problems for years and years and years, and then you find the carnivore diet and solve them all.
Hmm.